Hello, myself Dr. Syed Nazim. I'm a consultant dermatologist and hair transplant surgeon with more than 15 years of experience. Let's talk about hair transplant. So hair transplant, what is it all about hair transplant? Hair transplant is something which gives you more confidence. It boosts your self-confidence. It increases our social acceptance. That's what all we see. It increases the chances of better placements and good match. It's giving you youthful look and better look. Now, what are the different types of hair transplant? Ideally, after proper patient selection, the transplant is designed for that particular patient. It can be either FUE or FUT or DHI. So every person has a specific need. If there is a good donor area, the best technique will be FUE or DHI. If there is a less of a donor area, like we don't have good donor area and the recipient area where you want to implant the graft is quite large, then sometimes we do opt for FUT. However, FUE is more and DHI is more frequently being advised and performed across the world. Let's talk about the steps of hair transplant. So basically for males with male pattern baldness, they are the baldness, the grade of the baldness is divided with a scale. It's graded in a scale called Hamilton-Norwood scale. And anybody who has, it's from 1 to 7, the scale is from less of a baldness to more of a baldness, 1 to 7. Anyone from baldness above 3 is an appropriate candidate for the hair transplant. However, there are other factors which are equally important like age, what is the medical history and all these things. But the steps of hair transplant is first and foremost. First is the counseling of the patient, discussing the possible outcomes with the patient. Then the second is defining the technique, whether you want to go for FUE, FUT or DHI. The third is the preparing the patient for the surgery. While you prepare the patient for the surgery, we need to take a medical history, we need to do some lab investigations, rule out viral markers, any other infections. Once patient is fit for the surgery, then that surgery date, patient is advised to come and he can have a small breakfast in the mornings and we start the procedure well early in the morning. Depends on the number of grafts which are supposed to be implanted. The second step at this stage is we design the hairline, which is very, very important. Designing the hairline, here the face is divided into 3 equal horizontal halves and more or less the hairline is designed accordingly. Like for example, the middle 1/3 of the face should be equal to the upper 1/3 of the face. So accordingly, there are different ways to design the hairline, but it has to be aesthetically good. So many times people ask if मेरी hairline नीचे हो, ऊपर हो. It's not like that. It suits. It is customized for every patient's face. So that's how, and age, and that's how the hairline is designed. After the hairline is designed, then patient goes for the surgery. We do the numbingness around the area where the recipient area. Then after doing a local anesthesia in the recipient area, the silts are prepared. We know what the area which is to be implanted, the silts are prepared, the area like the small holes where the grafts will be implanted. After that, accordingly, then on the donor area, again the local anesthesia is done and again the grafts are taken. For example, with us, with people who have good experience, we use 0.8 millimeter punch to take the grafts and around, depending on the number of grafts, say 2,000, 3,000, 4,000, accordingly it takes time. So after then the grafts are taken, they are placed in a specific solution to prevent the life and the longevity of the grafts while then, and simultaneously in the same day we implant those grafts on the donor area. These are some steps of hair transplant, and after all is done, the patient is fit to go to home, and next day we call the patient for a review and where we take off the dressing on from the donor area and we go for and wash completely the scalp, give some instructions to the patients and the post care which is needed. Now, what should we expect from a hair transplant surgery? So we should expect hair grows back. Okay, we should expect that we get our confidence back. We should expect after say around 6 months, when there is a full-blown hair, It looks as normal, as natural, where you can comb, you can style, you can color that hair, and that's what is expected from a good hair transplant surgery. So what is expected from a hair transplant surgery? After a successful hair transplant, we should expect after 6 months a full-blown hair. So it takes around 6 to 8 months for the hair to completely grow into its anagen phase. We expect a good hairline. We expect that there should be no scars anywhere on our scalp, the recipient area. We expect the complete healing of the donor area after 2-3 weeks of time. So that's what is expected, and moreover, we expect good aesthetic results from any good hair transplant surgery. Now, how long it takes for a hair to grow after hair transplant surgery? So immediately post hair transplant, it takes around 2 weeks for the roots to start the activity of the growth. Okay, and after around 1 month, we can have a shedding of the stem of the hair, but the roots remain there. And slowly, gradually, within 4 months to 6 months, and after a complete 1 year, there's a full-blown hair grown as good as normal hair, where you can comb, you can wash it, you can style it in a way, or even you can color it the way you like. So this is all about the stages of the hair transplant and the process of the hair transplant. If you have any queries related to this, please do feel to contact us. Thank you very much.